All right, welcome to another deep dive. And today we're focusing in on the fundamentals of maternal and child health nursing.
Definitely, these are going to be so relevant for you guys in your courses right now.
Yeah, so we're going to be talking about things like putting families right at the center of everything we do.
Backing up our decisions with real research.
Being mindful of all the different cultures that we encounter in nursing.
And understanding that why behind that what.
Exactly. So you're not just memorizing facts for your tests, but really getting those concepts that are going to make you amazing nurses out there.
What I find really fascinating about maternal and child health nursing is that it's not just about caring for patients in the hospital.
It's way more than that, right?
It is. It's about empowering families to take charge of their health out in the community.
I'm so curious about that shift from hospital to community care. I've definitely noticed it's a big theme in all of our readings for this course. So what does that actually look like in practice?
Well, it means nurses are taking on a much bigger role.
Oh, I bet.
Think about home births with midwives or the crazy complexity of infant care that's happening in people's living rooms now.
Yeah.
Nurses have to be really adaptable, resourceful, and able to make critical decisions in all kinds of settings these days.
Okay, so let's dive into the first big concept here. Family-centered care. Now, it sounds like, a really nice idea, but what does that actually look like in the real world?
It's about realizing that the family is the one constant thing in a patient's life.
Yeah.
And their well-being has such a direct impact on the patient's health.
Especially when we're talking about moms and kids.
Especially then. Imagine a labor and delivery unit where families stay together in the same room throughout the entire experience.
The whole time.
The whole time. Labor, delivery, recovery, postpartum.
Wow.
That's a great example of family-centered care in action.
Okay.
It keeps that family unit together, it cuts down on disruptions for the newborn, and it helps with those early bonding moments that are so important.
That makes so much sense. So it's not just about providing the medical care, it's about creating that really supportive environment for the whole family.
Right.
And I'm guessing this approach isn't just limited to labor and delivery, right?
Oh, absolutely not. Whether you're working with a child with maybe a tough diagnosis or helping a new mom learn to breastfeed, that family unit is your partner. You're working with them and not just for them.
Okay, so we're building these strong partnerships with families.
Mm-hmm.
But then how do we make sure the care we're providing is the absolute best? How do we know it's based on the most up-to-date information?
That's where evidence-based practice comes in.
Oh, okay, I've heard that term a lot.
Yeah. It's about using the latest research and scientific findings to make our decisions as nurses.
Gotcha.
It's moving away from that, we've always done it this way, thinking, and toward what does the evidence tell us is really the best approach.
Yeah, okay.
So it's a shift.
I remember feeling kind of overwhelmed by all those research articles we had to read in class.
Yeah.
How do nurses keep up with all the latest findings and actually use them in their work every day?
There are some amazing organizations out there.
Okay, good.
Like AHAN.
What's that?
The Association of Women's Health, Obstetric, and Neonatal Nurses.
Oh, wait. Yeah.
They actually develop these evidence-based guidelines specifically for nurses who work in maternal and child health.
Wow.
And the guidelines are constantly being updated to reflect all the latest research.
So they're a really good resource.
Fantastic resource.
It's having a cheat sheet for best practices, but one that's always changing to stay current.
Exactly.
So you don't have to read every single article out there.
It takes a lot of pressure off. And remember, evidence-based practice isn't just about blindly following guidelines either.
Right.
It's about using your critical thinking to evaluate the evidence, think about the needs of your specific patient and their family,
Yeah.
and make decisions that are going to lead to the best possible outcome.
Okay, now I have to ask about a term I keep hearing. Atraumatic care.
So
It sounds a little scary at first. Can you break that down for us?
I can see why it might sound intimidating, but it's really just a compassionate way to approach care. It's all about minimizing the stress and anxiety that kids and their families feel when they have to deal with healthcare.
That makes sense.
Think about it. A hospital can be a really scary place for a child.
Definitely.
Atraumatic care is about making the experience as gentle and positive as we can.
So it's about acknowledging that a child's emotional well-being is just as important as their physical health.
Exactly. It's about using language they can understand, getting parents involved in decisions, and creating an environment that helps reduce fear and promote healing.
I'm thinking about those clinical rotations we have coming up, and I can definitely see how those principles of traumatic care are going to be so important when we're actually working with these young patients.
Yeah.
What are like some specific things we can do to put this into practice?
Oh, there are so many. Distraction, therapeutic play, offering choices whenever you can. Those are just a few examples. It's about thinking from the child's point of view and finding ways to make the experience less scary, you know?
It's like we're taking those play therapy concepts we've been learning about and actually using them in real life.
Exactly.
Okay, so we've talked about family-centered care, evidence-based practice, traumatic care. What's like the next big piece in providing great nursing care?
Communication.
Oh, of course.
And I don't just mean, talking. Effective communication is a core skill for nurses. It's how you build trust and connect with families. And that takes effort,
Yeah, and practice.
Yeah, absolutely.
I remember one of our professors saying that communication is like the foundation of the whole nurse-patient relationship.
Absolutely.
So what are some tips for actually communicating well with families, especially like when things are stressful?
Well, think about how you're asking questions.
Okay.
Open-ended questions encourage families to share what they're worried about and what they think.
Okay.
And be careful about the language you use. All that medical jargon can be confusing, especially for people who are already feeling stressed out.
It's funny because we talk so much about communication in nursing, but it's also something we just do in our everyday lives, Maybe we should all be working on those listening skills even when we're not at clinical.
That's such a good point. It's a skill that takes practice. The more you use it, the better you get at understanding and connecting with other people.
So true.
Yeah.
Speaking of connecting, what about those times when there's a language barrier? How do we make sure we're communicating clearly when families don't speak English?
That's such a crucial part of providing culturally competent care. You have to provide good interpreters. And that's not just about translating words. It's about bridging those cultural gaps and making sure families really understand the information and care they're getting. I remember this story in our book about a new mom named Maria who just couldn't understand her postpartum care instructions.
Yeah.
Because of a language barrier.
Oh, right. And the nurse on that first home visit didn't speak Spanish. And Maria didn't speak English.
Exactly. There was so much room for miscommunication there.
Totally.
It wasn't until the nurse brought a Spanish-speaking interpreter on the second visit that they were able to connect with Maria and really explain why they were doing certain things.
And it made a huge difference.
It did.
That story really shows how important it is to go beyond just the words. It's about trust. It's about building that connection, even with the language difference.
Mm-hmm.
And it's not just spoken language either, right? What about families who are deaf or hard of hearing?
Legally, we have to provide communication access for every patient, no matter how they communicate. So start thinking now about the resources you have in your area, like sign language interpreters or video relay services. It's about thinking ahead and being ready.
It adds like another layer of complexity to communication.
It does.
But it's so important that everyone has the same access to information and care.
Yeah.
So we've covered family-centered care, evidence-based practice, atraumatic care, and all the different parts of communication.
It's a lot.
What's next on our deep dive list?
Let's talk about education, that role of the nurse as teacher.
Oh.
Get ready, listener. You're going to wear a lot of hats as a nurse, and one of them is definitely a teacher's hat.
I'm ready to step into that role. Seriously, though, I've always seen nurses as educators.
Yeah.
Like helping patients and families understand what's going on with their health and make good decisions.
It's essential. But teaching patients well is more than just giving them a pamphlet or listing off instructions.
Right.
It's about finding out what they need, planning what you're going to teach, actually doing the teaching, and then checking to see if they actually learned what they need to know.
Right.
Does that sound familiar?
It's the nursing process all over again.
It is.
I have to admit, I'm kind of intimidated by that statistic we learned in class. The one about people forgetting 80% of what they hear in a doctor's office?
Oh, yeah.
How are we supposed to deal with that?
You have to be creative and engaging. Think about using interactive things, visual aids, having them teach it back to you.
Okay.
Anything to make that information stick. Remember, you're not just giving them facts. You're trying to empower families to take care of their own health.
So we need to make it relevant to their lives. Use clear language.
Mm-hmm.
And check that they're getting it along the way.
Exactly. It's about taking all those communication skills we were just talking about and using them to teach.
Totally.
And don't forget about that health literacy issue we mentioned earlier. That plays a huge role in how we educate our patients.
Right. So we need to use plain language, break down complex information, and make sure families really understand what we're trying to teach them.
Yes, exactly. And visual aids. Don't underestimate the power of a good picture or diagram.
Okay, I like that.
Even a simple drawing can make a big difference.
Okay, let's switch gears a bit and talk about community-based nursing.
All right.
It feels like the whole future of healthcare is happening right there in our neighborhoods.
Absolutely. We're seeing this move away from long hospital stays and more chronic conditions being managed at home.
Which makes sense.
It's more comfy for patients, often less expensive, and it keeps families together.
I need some real-life examples to, really understand this. What kind of care is actually going on out in the community?
Okay, so imagine home births led by midwives.
Okay.
High-tech infant care equipment set up right in people's living rooms.
Wow.
IV antibiotics being given at home.
Okay.
It's changing all the time.
That paints a picture of how nursing is really evolving.
Yeah.
But I have to admit, there's one topic I'm a little hesitant to bring up.
Let me guess, Cam.
Yeah.
Complementary and alternative medicine.
You read my mind. It feels a little bit like a minefield, especially when we're talking about mothers and children,
I get it, but as nurses, we have to approach this with balance. It's not about saying every single alternative therapy out there is great.
Right.
But it is about knowing what our clients are using and understanding if there are any interactions with regular medicine.
So it's about having those open, honest conversations with families, respecting their choices, but also giving them good information.
Exactly. Let's say a woman's using ginger to deal with morning sickness. We need to know about that, understand the good and the bad, and give her evidence to help her make good decisions.
And what about those times when families are using CAM instead of conventional treatment? I'm thinking about things like acupuncture for pain or herbs for postpartum depression.
That's where things get a little trickier. Our role is to teach families about the risks and benefits of CAM, encourage them to talk to their doctors about it, and advocate for a team approach that blends conventional and alternative whenever possible.
So it all comes back to that patient-centered care, right?
It does.
Respecting their beliefs, but giving the best guidance we can.
Exactly. It's finding that balance between honoring what they want and using evidence to guide our practice.
Wow. This deep dive is already packed with so much information.
I know.
And I feel like we're just scratching the surface here. What other cool insights are waiting for our listeners in this world of maternal and child health nursing?
It's interesting how all of these concepts we're talking about, they all kind of connect back to the nursing process.
Yeah.
It's like the foundation, no matter what we're talking about in nursing, we always come back to that.
It's like her roadmap. It guides us through every single patient interaction.
Yeah.
Assessment, diagnosis, planning, implementation, evaluation. It's all coming back to me now.
Exactly. But here's where it gets really interesting with maternal and child health.
Okay.
You're using that nursing process for both the mom and the baby, always thinking about the family as a whole.
Oh, so it's like double the complexity.
Yeah.
How do nurses keep track of all those different pieces and make sure everyone's needs are met?
It takes practice and organization and a lot of communication. Like, let's say you're working with a new mom who's having trouble breastfeeding. Your assessment isn't just about checking how the baby's latching or if they're gaining weight. You're also thinking about the mom's emotions, her support system, any cultural things that might be affecting her.
Oh, wow. That's a lot.
It's a holistic approach.
It's almost like you're a detective.
Haha. Yeah.
Gathering all these clues to figure out what's really going on.
That's a great way to put it. And once you have all those pieces, then you move on to the diagnosis or the analysis phase.
Right.
That's where you're figuring out, okay, what are the main issues here, the things that we really need to focus on in the care plan?
And this is where our critical thinking skills come in, right?
Exactly. Taking all that information and saying, okay, what's really going on here? What needs to happen next?
And then the planning stage.
Right. So working with the family, you're going to set some goals, come up with some strategies, figure out those specific things you're going to do to provide care.
So it's like creating a blueprint, but one that you can change if you need to.
Exactly. It has to be flexible because families' needs change all the time. And remember, this whole planning part is a team effort.
Yeah, for sure.
You involve the family, you listen to what they want. It's a real partnership.
Okay, we've assessed, we've diagnosed, we've got a plan. Now what?
Now we implement. This is where all those nursing skills you've been learning really come into play. You might be giving direct care to the mom or baby, maybe giving meds, educating the family, talking to other healthcare providers.
Wow, that's a lot of hats to wear.
It is.
It's a little daunting, but also really exciting. I'm starting to feel a little bit like, a superhero in training.
Haha. Well, nurses definitely have superpowers.
Yeah.
Especially when it comes to sticking up for their patients and making a difference in their lives. And don't forget, you're not alone in this. You'll have experienced nurses, doctors, other healthcare pros to help you along the way.
That makes me feel better.
Yeah.
But even with a great team, we have to make sure we're actually doing things that work.
Yeah, exactly.
Where evaluation comes in, making sure the things we're doing are actually helping.
Right. We're always checking to see if our care is effective, looking at the patient again, and changing things up if we need to. It never really stops. It's how we make sure we're always giving the best care possible.
It's like one big continuous quality improvement project.
Exactly. And as you get more experience, you start to develop your own intuition. Your clinical judgment gets better. And you'll get even better at using this nursing process in all kinds of tough situations.
I like the sound of that, developing that sixth sense of what needs to happen.
It's a process.
Yeah. So we've got our roadmap, the nursing process, but what about the big picture stuff that makes sure we're giving safe care, ethical care, all of that?
That's where those professional standards of care come in. Organizations like the American Nurses Association and AHON, they've put together these specific guidelines that tell us what's expected of us as nurses.
So it's like everyone's playing by the same rules.
Exactly. These standards cover everything from how we assess patients to how we talk to families to how we use evidence-based practice. They help keep things consistent no matter where you're working or who you're taking care of.
And these standards are always changing, right? As new research comes out and new ways of doing things, it must be hard to keep up with it all.
It's definitely a lot, but it's our job as nurses to always be learning, to stay updated, and to make sure what we're doing matches the latest guidelines.
Okay, so we've talked about the nursing process, those standards of care, all those basic concepts. Now, I want to go back to community-based nursing for a bit. We touched on it earlier, but I'm really fascinated by it. So what does it really mean to be a community health nurse?
Oh, it's such an interesting field, and it's always changing. It's about keeping people healthy and preventing illness, not just treating people who are already sick.
Yeah.
It's about looking at the big picture, the things in society and the environment that affect people's health.
So it's like healthcare on a much bigger scale.
Exactly.
Yeah.
Think of a nurse who's working on a vaccination program or teaching people about prenatal care. They're not just treating illnesses, they're stopping them from happening in the first place.
And then a community-based nurse might be the one actually giving those vaccines or visiting new moms at home.
That's right. They're both working towards the same goal, but from different angles.
But why are we seeing such a big push towards community-based care these days? What's going on?
Well, for one, healthcare is expensive.
Oh, yeah.
Hospital stays can really drain your bank account. And a lot of those procedures and treatments, we can do them just as well and sometimes more comfortably right at home.
That makes sense.
And people are starting to realize that hospitals aren't always the best place to get better, especially kids.
Yeah, being at home, surrounded by your family, that's got to be better.
Exactly. Your own bed, your toys, the comfort of your family. Those things can be more powerful than medicine sometimes. And for new moms, recovering at home means they can relax more, set up routines with their baby, and have their loved ones around to help. It just makes things easier for everyone.
Okay, I'm sold. Community-based care sounds great. But what does it actually look like in practice? What are those nurses out there doing?
They're doing everything. Prenatal care, giving IV antibiotics, checking how babies are developing.
Wow.
They go to people's homes, schools, clinics, wherever their patients are.
It sounds like you need to be super resourceful and flexible to do that kind of work.
You do. And you need to know all the different resources that are available to families. You need good assessment skills, great communication, and the confidence to work independently and make decisions when things change quickly. You're often out there on your own, advocating for your patients and working with different healthcare providers.
Wow, that's a lot.
It is.
You're like the unsung heroes of healthcare.
Haha. Well, they're making a difference, that's for sure.
Okay, so we've explored that whole world of community-based nursing, but what about those more specialized settings? Like birth centers.
Oh, yes. Birth centers are great.
I've always been curious about them. I love the idea of a more natural, less medical approach to giving birth.
They're a good option for women with low-risk pregnancies. They get that cozy, home-like setting, but they still have access to medical staff and emergency care if they need it.
So it's like a mix between a hospital birth and a home birth.
Exactly. Birth centers are all about giving women control over their labor and delivery, encouraging them to participate, and cutting down on unnecessary interventions.
It sounds really empowering.
It can be. And for women who are okay with not having any medication and want the most control possible, there's always home birth.
That's when things can get a little controversial,
Yeah.
right?
Yeah, there are strong feelings on both sides. But it's important for us as nurses to understand the pros and cons of home births so we can support our patients in making their own choices.
So no matter where a woman chooses to give birth, what's the most important thing for making sure it's a good experience?
Having access to good, compassionate care, whether that's a midwife at home, a team at the hospital, or the staff at a birth center, that human connection, that expertise, it makes all the difference.
Speaking of expertise, let's switch gears a bit and talk about postpartum care. Those first few weeks after a baby is born can be such a crazy time for the whole family.
It's true. And with hospital stays getting shorter, nurses have to be ready to step in and provide great care during those first few weeks at home.
So what are some of the challenges new moms face? I can imagine it's pretty overwhelming.
Well, there's all the hormonal changes going on, the physical healing after birth. They're not getting much sleep.
Oh, man.
And then they have to learn how to take care of a brand new baby.
It's like a crash course in parenting.
Right. And on top of that, they're trying to figure out breastfeeding, understand what their baby's trying to tell them, and adjust to being a mom. It's a lot.
Okay, so how can nurses help during this time? What are some things that can make a real difference?
One of the best things is a postpartum home visit. The nurse can check on how the mom's doing, both physically and emotionally, see how the baby's doing, and give them information and support right in their own home.
That's great, bringing that expert care right to them.
And it's really helpful for spotting any problems early on, dealing with breastfeeding issues, and connecting families with other resources in the community.
Oh, like what kinds of resources?
Well, things like lactation consultants, support groups, even financial help. There are so many great resources out there, and nurses can help connect families to the support they need.
It's like building a safety net, making sure they don't fall through the cracks.
Exactly. And let's not forget about how important it is for moms to connect with each other. Support groups can be a lifesaver during those early weeks and months.
I bet. Just having other women who understand what you're going through without judgment.
Exactly. It's a place where you can talk about what's happening, ask questions, let out some frustration, and just support each other. And there are all kinds of support groups, from ones that meet in person to online forums to just hanging out at the park.
And for those who can't get out to a group or maybe just prefer to stay anonymous, online forums can be really helpful.
Oh, yeah. It's like having a whole community at your fingertips.
Okay, so we've talked a lot about postpartum support for moms, but what about the babies? What are some of the key things we need to know about newborn care?
Newborn care is fascinating, and it's always changing. With those shorter hospital stays, we're seeing more complex newborn care happening right at home.
It's amazing how much technology is allowing us to do at home now.
I know, we're talking about high-tech monitoring, IV meds, specialized therapies, all happening at home.
That must be a huge adjustment for families, though,
Mm-hmm.
to suddenly be responsible for that level of care.
It is, and nurses are there to teach them, help them troubleshoot any problems with equipment, and provide ongoing support so those little ones get the care they need.
So what are some things nurses should keep in mind when they're working with families who are doing this at home? It seems like it would take a lot of trust and communication.
Absolutely. It's really important to assess how prepared they are, if they understand how to use the equipment, and if they're able to handle the demands of around-the-clock care. It's a whole new level of parenting education.
I bet. It's like they're becoming mini experts in their baby's medical needs.
They are, and nurses are there to guide them, empower them, and make sure they feel confident in taking care of their baby.
It's a team effort, really. The nurses provide expertise, but ultimately it's the parents who are the true heroes in these situations.
Couldn't have said it better myself.
Okay, so we've talked about a lot. Family-centered care, the nursing process, postpartum, and newborn care. What other important things should our listeners know as they start their journey in maternal and child health nursing?
You know, we've talked a lot about pregnancy, childbirth, that whole newborn phase, but maternal and child health, it really covers a woman's entire lifespan.
Oh, that's right. It's bigger than just like becoming a mom.
Yeah. And community-based care is huge in making sure women of all ages have access to the care they need.
Okay, so what kind of services are we talking about out in the community?
Think about things like those screening centers. The ones that do mammograms, pap smears, bone density tests, all those preventative things that are so important.
Yeah.
And then you've got educational centers. They give information on all sorts of things like menopause, heart health, cancer prevention.
So it's like a one-stop shop for women's health right there in the community.
Exactly. And don't forget those counseling centers. They offer support for all sorts of issues: postpartum depression, domestic violence, all kinds of things. A lot of times, these services are part of those community health centers, so it's easier for women to get the help they need.
It's really cool how much is happening outside of hospitals these days. It shows how healthcare is changing to be more holistic and community-focused.
It's a good thing. It's all about empowering women to take control of their own health, make informed decisions, and get the care they need to live long, healthy lives.
And these services are offered in lots of different places, right? Not just clinics and hospitals.
Oh, for sure. You'll find women's health services in community centers, schools, even mobile units that go to areas where people might not have easy access to healthcare. It's about meeting women where they are.
Totally. Speaking of breaking down barriers, I want to go back to culturally competent care for a minute. We've talked about it a few times, and I think it's something nurses have to think about every single day.
Absolutely. Culturally competent care isn't just about knowing the facts about different cultures. It's about approaching each patient with respect, wanting to learn from them, and realizing that everyone's experience is different.
It's about, really trying to see the world through your patient's eyes.
Exactly. We need to understand how their culture affects their health beliefs and how those beliefs might change what kind of care they're willing to accept. Like, there was this story in one of our readings about a nurse practitioner working in a rural community in Guatemala.
Oh, yeah, I remember that one.
She was treating a girl with a broken wrist, but the interpreter explained that in that community, a girl with a deformed wrist might not be able to make tortillas, and that could have a huge impact on her life.
It's crazy how a broken wrist, something we might see as pretty simple, can mean something totally different depending on the culture.
It really is. That's why it's so important to ask open-ended questions, really listen to the answers, and be open to changing our own minds about things.
Culturally competent care is a journey, not a destination, right? It's something we're always working on.
So true. It's a constant process of learning, unlearning, and relearning as we meet new people and hear their stories.
So for all those listeners out there who are just starting their nursing journey, what's the one thing they should remember about culturally competent care?
Just be humble and open-minded. Be willing to ask questions, hear people's stories, and learn from their experiences. Those real connections are how we give care that's truly compassionate, effective, and respectful of everyone's culture.
That's such a great point. And I think it's the perfect way to wrap things up. We've covered a lot of ground in this deep dive, from family-centered care to the nursing process to all the ins and outs of community-based nursing.
Yeah.
It's really given me a whole new understanding of maternal and child health.
Me too. And for our listeners, I hope this is just the beginning. As you learn and grow as nurses, take every chance you can to learn, make a difference in the lives of families, and really embrace this field.
Yeah, maternal and child health nursing is full of amazing opportunities. And with all your learning, you can be advocates for families, fight for health equity, and provide compassionate care that impacts generations to come. So go out there and make us proud.
Until next time, keep learning, keep asking questions, and never lose that passion for maternal and child health.
This is your Deep Dive. Signing off.